Is it possible for someone with severe bipolar or schizophrenia to come off all of their psychiatric medications after decades of use because of a dietary change? I believe that's true. Stay tuned to learn why. For those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist, and I run the Tabor Clinic, a medical practice that specializes in getting people off psychiatric medications. Today, we're going to be talking about the 2 dietary interventions that we recommend here at the Tabor Clinic. And we've picked these diets because both of them have a great track record in improving not only your mental health, but also your physical health too. So this introductory video is going to guide you through why we strongly recommend these diets for people with psychiatric symptoms. And so our recommendation is going to be that you try these diets consecutively, meaning that you build them on top of each other. So you're going to start with the first diet, and if you're still having residual symptoms, then you're going to move on to the next diet. So let's jump in and learn more about them. So the first diet we're going to recommend is a paleo whole foods diet. So the paleo diet takes us back to the foods that we evolved eating. These were the foods before the agricultural revolution, when we started farming a lot of things like wheat, and they became big staples in our day-to-day diet. This paleo-style diet emphasizes fruits, vegetables, and high-quality animal proteins while avoiding foods that were unnatural to early humans. These are things like seed oils, dairy, large quantities of legumes such as soybeans and peanuts and lentils, and processed foods and additives. Now, while it may make intuitive sense that returning to the diet we ate for most of our evolutionary history could have health benefits, there's actually a substantial amount of science backing why this diet can be so powerful for not only your mental health, but also your physical health. First, the paleo diet removes several of the most common food sensitivities. This includes things like grains such as gluten, but also dairy and legumes like soybean, which are known to affect a large number of people. But besides it being helpful because it avoids common food sensitivities, it's actually a low carbohydrate, low sugar diet. This is because it avoids grains, so you're not going to be having things like gluten and pasta and rice. And so it's much higher in protein and much higher in fat than the standard American diet. And this is very beneficial for numerous reasons, which we're going to be going into detail in this video. Now, I'm not going to leave it just there with the paleo diet, because I know I'm firing some shots right now. I'm talking about removing really beloved foods, things like cereals, breads, pasta, and even oats. And so I believe a deeper dive here is necessary to make the case for why inconveniencing yourself by removing these foods is worth the effort. So let's start with the grains. And I'm going to start by talking about gluten, which is a protein found in many different types of grains such as wheat, barley, and rye. So gluten has a compound in it called gliadin. And this compound can increase the permeability of the gut wall, and it can cause something called leaky gut. And when you develop leaky gut, this means that particles that normally shouldn't pass through your gut wall can end up in the bloodstream. These particles can include bacteria, food particles, and toxins that spark inflammation, which can contribute to physical and psychiatric symptoms. And when you remove gluten, it gives the gut wall a chance to heal, and it stops the immune response that's disrupting the body's balance. Now, many people will assume that they don't have a problem with gluten because they've tested negative for celiac disease in the past. However, there are a large number of people who suffer from something called non-celiac gluten sensitivity, and these people, even if they test negative, do benefit from removing gluten from their diet. And then there's another situation where people suspect they don't have any problems with gluten because they don't have digestive symptoms like diarrhea or constipation. However, for some people, it's a mistake to believe this because up to 50% of people with celiac actually don't have GI symptoms. They have symptoms that show up in different areas of the body, such as having brain fog, fatigue, or even anxiety. And because the tests cannot reliably rule out whether anyone is going to be sensitive to gluten, we believe that the best approach is to remove gluten from the diet and then observe any improvements. I don't want to underemphasize how much of a dramatic improvement removing gluten from the diet can be. There are numerous case reports in the medical literature with people who have had severe mental illness for decades having it all go away and then safely coming off medications because they went on a gluten-free diet. We even have a story in-house in our actual program. Trudy, one of our coaches, was on psychiatric medications for over 20 years until she transitioned to a gluten-free diet, and she came off all her medications and has been well ever since. The improvements with the gluten-free diet can be so life-changing that even Dr. James Greenblatt, who is widely considered to be the leader in the space of integrative and functional psychiatry, even says that every single patient who has a psychotic illness should be given at least a trial of a gluten-free diet to see if it can resolve or greatly improve the person's symptoms. Now, the other reason why it can be important to get rid of grains, even the grains that don't contain gluten, things like rice and oats, is that that they are low in nutrient density and they have very high sources of carbohydrates that break down quickly into sugar. And so what this means is they often spike your blood sugar and they can worsen insulin resistance. These types of high carbohydrate diets can contribute to weight gain and also psychiatric symptoms, which we're going to be discussing more later on when we talk about the ketogenic diet. Now, the next food that requires a special mention is really dairy. Again, I'm sorry in advance. As a former dairy lover, this can be a really hard one to swallow. So dairy presents problems for numerous reasons. Firstly, many people are actually lactose intolerant, meaning they lack the enzyme needed to digest lactose. That's the sugar that's in milk. Not only does this cause a lot of gassiness, it can alter the gut microbiome by bathing it in sugar that the human body simply is unable to digest. And over the last 2 decades, we're seeing more and more data out there that the actual structure of your gut microbiome is very important in how people feel. Now, not everyone with lactose intolerance needs to stop all dairy products. In fact, some people who are lactose intolerant can tolerate things like yogurt or even hard cheeses, as because part of the fermenting process that makes these products, it involves bacteria which often break down a lot of the lactose before the end product is made. However, that's not the whole story, because dairy also contains proteins that can trigger immune responses in patients even without lactose intolerance. What that means is that those patients aren't actually having problems with breaking down the sugar, but they're actually reacting to some of the proteins in the milk, such as casein or whey, which are common food sensitivities that can cause inflammation for some people. Now, to end this section on a high note, what I do want to say is that many people who are allergic to milk protein or people who are having problems with lactose intolerance, they can tolerate ghee. Now, ghee is essentially clarified butter, and it is mostly fat. And so because it doesn't have any lactose and it doesn't have any milk protein in there, many people can still enjoy the buttery and nuttiness of ghee, which is really common in Indian foods and really can be used as a butter substitute in a lot of other foods. Now let's move on to talk about the next category that might seem a little unusual to you, and that is the avoidance of legumes. Now, if you're like me, this may be a surprise to you because you're probably told that things like peanuts and soybeans and lentils were actually healthy. These were a good source of protein. However, while that may be true, what is often overlooked by many people is that these foods are high in something called lectins. Now, lectins are a protein found in legumes that bind to the gut wall and make it leaky. Yes, they're just like gliadin from gluten. And if you remember from that previous section, when you have a leaky gut, you get a lot of gastrointestinal byproducts entering the bloodstream, causing inflammation, things like bacteria and food products, and they generally tend to make people feel unwell. On top of that, legumes also contain something called phytic acid, which is classified as an anti-nutrient. What this means is that this product binds to minerals around it in the gut, things like your calcium, your magnesium, your iron, and your zinc, and they make them less available for the body to absorb. This means that people can be eating a lot of these foods, but they're not really absorbing the nutrients from them or the nutrients from foods that they're eating along with them. And so what we see is for people who rely heavily on legumes for nutrition is that they can actually develop some nutritional deficiencies over time. On top of this issue, just like with the grains previously, if you're eating a lot of legumes, they are fairly high in carbohydrates, and they can also contribute to spikes in your blood sugar, which is problematic for a number of reasons that we're going to be discussing shortly. Now, the last thing that I think is really important to know about the paleo diet is that it excludes processed foods, which are essentially factory-made foods that are packed with additives and preservatives. I like to think of processed foods as essentially junk foods. So with the high sugar content, they can really spike our blood sugar and cause cravings and lead to a whole range of addiction-like responses to food. On top of that, many of the food dyes and the additives that they use in processed foods, especially in the US, they're even banned in Europe due to their potential impact on health, particularly in children prone to hyperactivity. Unfortunately, in the US, because of our government regulation, we have a much higher threshold for banning these types of food products. In my opinion, I think to the detriment of the health of the US population. And so one of the great things about removing processed foods from the diet is it's going to allow you to, one, you're going to avoid the sugar, but you're also going to avoid all these chemicals that are in there, all these preservatives and food dyes and things like MSG that are put in there to make the foods tasty. But really, the human body was never really designed to encounter a lot of these things, and they also caused a lot of reactions in people. Okay, so now that we've done a walkthrough of the paleo diet, let's talk about the next diet in the list. So if you've done the paleo diet and your symptoms still haven't resolved and you're looking to try something next, I would recommend working with a dietitian or medical professional to try a ketogenic diet. Now, the ketogenic diet differs from the paleo diet because it restricts the amount of sugar and carbohydrates you can consume. With the paleo diet, you don't have to monitor them. Now, as long as you're avoiding things like grains and legumes, which are high in carbs, you don't need to monitor what you're doing with the other foods. I mean, you can have as many fruits that you'd like. You could have potato or sweet potato. There's no real calorie counting or any kind of caps on carbs. Now, this is different with the ketogenic diet because with this diet, you are purposely trying to get your body into a state of ketosis. This means that you've restricted the amount of carbohydrates that you're consuming, that your liver is now starting to produce an alternative fuel source called ketones. Typically, to get into a state of ketosis, you have to restrict your carbs to less than 50 grams a day. Now, why go through all of the trouble of limiting carbs? I mean, with the paleo diet, we already took away things like breads and pasta and rice. Why would we take away things like lots of potatoes or fruit? And there's a good reason for this. And it's all about blood sugar regulation, insulin resistance, and the effect that they have on your mental health. Now, this may not be you, but I know that there's a lot of people out there who write off the ketogenic diet as being some kind of fad diet that's just going to be around for a little bit. And there's no real scientific backing to it at all. But that's really not the case here. Now, I want people to sit up and listen because we actually have good clinical trial data of using the ketogenic diet in people with severe mental illness where it has led to remarkable outcomes. And I'm going to briefly talk about two of these studies. Now, the first study I want to talk about was a study conducted in France by Dr. Danon and his team. And in this study, they brought in 31 of their sickest patients to an inpatient psychiatric hospital, and then they gave them the ketogenic diet. And here's what they found. Over the period of time that these patients were there, 100% of them experienced an improvement in their symptoms. 43% of them achieved clinical remission. That is dramatic considering these patients were diagnosed with bipolar disorder and schizophrenia and major depression. 96% of them experienced weight loss, and 64% of them were discharged on less medication. To put this in perspective, these results are mind-blowing, and as someone who used to work at the FDA and look at clinical trials, you would never see results like this from any type of psychiatric medication. Not only are the clinical improvements dramatic, but also the fact that instead of having side effects, a lot of people had side benefits, such as losing weight. Now, the next study that I want to talk about was a study that was completed this year by Stanford by Dr. Sethi and her team. This study looked at 21 outpatients, 16 of whom had bipolar disorder, and 5 of whom were diagnosed with schizophrenia, and they treated them with a ketogenic diet. And what they found was that 79% of these participants with bipolar or schizophrenia experienced a clinically meaningful improvement in their symptoms in response to the ketogenic diet. Those are remarkable results for a dietary intervention in patients with severe mental illness. So let's talk a little bit about why these dietary interventions may make some people feel better. And it really boils down to 3 things: insulin resistance, inflammation, and oxidative stress. So let's start with insulin resistance. Currently, around 50% of the US population has insulin resistance, and this is largely due to excessive carbohydrate and sugar intake. Now, if we were to compare the amount of sugar that we eat today compared to what we used to eat 200 or 300 years ago, the amount of consumption has risen 15-fold. And this is mostly because of our high grain and our sugar-filled diets. Now, the problem with this is that high levels of glucose can be toxic to the body and it doesn't tolerate it well. And so to bring glucose down, what it does is secretes a hormone called insulin. And the role of insulin is to move glucose out of the bloodstream and into the cells where they can burn it for energy. However, if you're constantly eating a high carbohydrate, high sugar diet, you're going to continually be secreting larger and larger amounts of insulin. And over time, this leads to something called insulin resistance, where the cells become numb or muted to the effects of insulin, and you need to create more and more of this to respond. Now, this ties into a problem called type 2 diabetes, where essentially the pancreas poops out and it can't create the amount of insulin that's needed to bring all of the sugar into the cells. And then people start to have a lot of medical problems because of this high sugar wreaking havoc all over the body, causing visual problems and problems with the kidney and peripheral neuropathy as well. Now, what does insulin resistance have to do with brain health? Now, what researchers have found is that as insulin resistance develops, the neurons in the brain become less able to pull glucose into them and use it for energy. This is a state called cerebral glucose hypometabolism. And there's a lot of interest around this because many researchers currently believe that this is responsible for the majority of Alzheimer's. So what they're saying is that, Alzheimer's isn't caused by some other factor. What they're saying is that as people become more insulin resistant, the neurons, they cannot pull glucose into their cells and use it for energy. And so the neurons in the brain are starving for energy. And so when they look at these populations of people who have insulin resistance and they follow them over time, what they find is that insulin resistance and also this state of glucose hypometabolism, which they can measure by looking at the brain, they predict memory impairment and the development of Alzheimer's. And this trajectory of worsening cognitive status that falls in step with insulin resistance has led many to actually call Alzheimer's now type 3 diabetes. Now, while we have growing and compelling evidence that insulin resistance is causing problems like Alzheimer's, it's not that much of a step to believe that these same processes could actually be involved in causing psychiatric symptoms as well, like depression or anxiety. Now, one of the reasons why the ketogenic diet can be effective for psychiatric conditions, but also things like Alzheimer's, is that when you go into a state of ketosis, not only are you making a different fuel source, right? You're now making ketones, which the cells in the body can easily absorb and use. But you're also fixing insulin resistance, meaning that those cells are going to be better able to pull glucose out of your bloodstream and use it for energy. Now, the next reason why the ketogenic diet can be very helpful for both your mental and physical health is that it reduces inflammation. One of the problems with consuming a lot of carbohydrate and glucose for energy is that it can lead to the formulation of something called advanced glycation end products, or AGEs. These are compounds that are created when these sugars bind to proteins or fats around the body, damaging them. This process, called glycation, happens naturally when people are consuming glucose, but it accelerates and becomes more problematic when people have high blood sugar. And so when you have a lot of these AGEs, they start to accumulate in different tissues around the body, and immune cells start to bind to them to remove them. And when immune cells bind to them, it creates an inflammatory response. And this inflammatory response, if it goes on, it can actually damage the tissues that it's binding to. And this can lead to a whole bunch of problems in different areas of the body. For instance, if this is happening in your blood vessels, these inflamed blood vessels over time become less flexible, and it leads to things like hypertension and increased risk for cardiovascular problems. If it happens to the blood vessels in the liver, it can lead to something called chronic kidney disease. And if it happens to the small vessels that supply the tiny nerves in your hands and feet, it can start to kill off those vessels and starve the nerves there that are relying on those vessels, leading to diabetic peripheral neuropathy, where you have burning and tingling in your hands and feet. And so one of the most beneficial things that we can do to reduce this level of inflammation, which is taking a toll on the tissues in our body, is to cut back on high sugar intake. Now, the final reason why the ketogenic diet can be very helpful is that it reduces oxidative stress, which is a byproduct of constantly using glucose as the cellular fuel source. Our bodies over time have evolved to run on two fuel sources, glucose and ketones. And for a long time, we would switch between burning those two different fuels. When we had carbohydrates, we would burn the glucose. And then when we didn't have carbohydrates, we would switch over to using ketones. And this was very common prior to our industrial life, where now we have a lot of access to plentiful carbohydrate-rich food. And because of that, many people will actually never go into a state of ketosis where they need to burn ketones. Now, the problem with that is that glucose metabolism in the cell actually produces more free radicals compared to ketones. So what are free radicals? Essentially, these are reactive oxygen species. I want you to think of them as byproducts of glucose metabolism. And so just a little lesson in biology here. You have a cell, and inside the cell, there's something called a mitochondria. And the mitochondria essentially uses glucose and ketones to turn it into something called ATP. ATP is what the cells use for energy. Now, the process in turning glucose and ketones into ATP is different. And glucose, when it is metabolized into ATP, produces more reactive oxygen species or free radicals. Now, these byproducts of glucose metabolism, they can actually bind to different things in the cells, like proteins or DNA, and they can damage them. But the human body has a way of counteracting this. In fact, we produce our own antioxidants, and we get our own antioxidants from food. And so they can neutralize these byproducts in the cell and prevent them from damaging things. A useful metaphor to think about this is kind of like the mitochondria being a factory, and the free radicals or reactive oxygen species, they're kind of like smoke coming out, sort of polluting the air. And our antioxidants are like a filter that you put over the factory that pulls out all of that smoke. Ketones, on the other hand, when they're used by the mitochondria, they don't produce a lot of free radicals in these byproducts. So they're a much cleaner fuel to burn. And so The issue that we run into with a high carbohydrate, high sugar diet is that we're constantly using glucose, meaning that we're creating these free radicals that are overwhelming the cell's antioxidant capacity. And because of this, these free radicals start to damage the cells and impair the functioning of organs. This is especially relevant to the brain, which is our most metabolically active organ in the body. Despite being only 2% of our body weight, our brain uses over 20% of the fuel in our body. And so if we're having these problems with the overproduction of free radicals and the depletion of antioxidants, it is especially detrimental to our neuronal health. So one of the reasons why going into a ketogenic diet can be so helpful for your cellular and your neuronal health is that it gives the cell a break from burning glucose and generating more of these free radicals, and it gives it a different fuel source that doesn't produce as much of them. And as a result of that, you're able to give the cell a break and not burn through all of the antioxidants and cause all that cellular damage. Okay, so I know that was a lot and it got kind of sciencey there, but I do think it's helpful to go into the real reasons why these types of dietary interventions can be so helpful. And so let's summarize. One, the ketogenic diet, it's going to reverse insulin resistance and it's going to provide the brain with an easy source of energy to use, which is ketones. It's also going to minimize total body inflammation by reducing those AGEs, those advanced glycation end products. And finally, it reduces cellular stress and damage by reducing free radical accumulation. And while I do think it's important to know the real sciencey reasons for this, probably the most compelling reason to believe in the ketogenic diet is that it simply works, and we have great clinical research showing that it's effective in patients with schizophrenia and bipolar disorder. And the medical literature is just filled with case reports of people having remarkable improvements with this diet, such as this case report submitted by Dr. Westman, who describes a 7-year-old woman with chronic schizophrenia who weighed 330 pounds. She'd been hospitalized numerous times throughout her life for psychosis and paranoia and suicidal ideation, and she had had multiple suicide attempts. Within 8 days of implementing a low-carb, 20 grams per day ketogenic diet, her symptoms improved. And after 12 months, she had stopped all medications and lost 150 pounds and experienced a complete resolution of 63 years of auditory and visual hallucinations. And according to the author, at the time that this was published back in 2009, 12 months after she'd come off all of her medications, she was still symptom-free and was now living independently. Or what about this case series published by Calabrese in 2024, where they looked at 3 adult outpatients with major depressive disorder, generalized anxiety, and various other medical concerns, who all achieved full remission of their major depressive disorder and generalized anxiety disorder, all within 12 weeks of starting a personalized ketogenic diet. And finally, if there are some people who really want to hear it from the mouths of patients who have gone through this, there is the Metabolic Mind YouTube channel, and they have a playlist called Stories of Lived Experience with Ketogenic Therapy, where it goes into the personal stories of people who have recovered substantially from their mental health problems by using these diets. Truly, these interventions are incredibly powerful and can have life-changing impacts on people's health. And this area of research is so hot at the moment. Last time I checked, there were nearly 10 clinical trials going on at major academic institutions around the world, all looking at the ketogenic diet in different psychiatric conditions. However, what I would say is that for us here today, we do not need to wait for this research to start trying some of these dietary interventions to get people to feel well again. The paleo diet is safe to try on your own, but the ketogenic diet I would recommend you do with a nutritionist or a dietitian who knows what they're doing, or a medical provider, because it is a more complicated diet and there can be some complications. And so I hope this presentation has really given you a nudge to start to look at these dietary interventions. They can be some of the most powerful non-drug interventions out there that you could do for your mental health. And for many people, they actually perform much better than the drugs ever did. If you're looking to learn more about the ketogenic diet for mental health, you're going to be really interested in this interview that I did with Georgia Ede.